technological, and what I mean is that we need to make an acceleration of healthcare digitalization, because most of the solutions to local problems could be done through technology. But when I say acceleration of digitalization, we need to have an interoperability between the platforms, the existing platforms, and to build new platforms. So this was for the second area. Now, with your permission, I will focus on the first challenging area, which is the governance and policy. I think everyone would agree with me that in Africa and in low-middle-income countries, the top priority is ensuring a universal health coverage. To ensure a universal health coverage and extend it to 100% of the population, and to services such as the treatment and diagnosis of NCDs, the non-communicable diseases, you need to lower down the out-of-pocket levels, because most of the out-of-pockets are not being paid for by commercial or private insurance. It is being paid for by households. You'll be very surprised that in Africa, in actually 20 countries out of the 54 in Africa, the level of out-of-pockets as a total of health expenditure is above 38% in 20 countries. In the 15 countries out of 54, the level of out-of-pocket is between 21 and 37%. This is huge. Families get bankrupt with that. So in order to achieve the health security and in order to achieve the universal health coverage, you need to reduce the levels of out-of-pocket. So this is number one. And this comes under a good health system financing, all right? Unfortunately, there is an inefficiency in the financing of most health systems across low and middle income countries in Africa and in the Middle East and North Africa, of course. The second inefficiency I would love to point out too is an inefficiency in procurement. What I mean by that, I will start by giving a figure. In the lower income countries, not in the high income, in the high middle income or the upper middle income countries, but in the lower income countries, 80% of the health products are being procured through the private sector. And this is clearly an inefficiency as well, because when you are in front of a market that is dominated by a few suppliers, there will be a monopoly, right? And there will be a few supply, and if there is a few supply, there will be a high cost, and if there is high cost, it will be pushed down to the end user, and so we end up having out-of-pockets that are levels that are very high, and so we are not going to ensure the universal health coverage and the affordability and the supply of essential medicines, actually. So I think those are the key areas or the key inefficiencies that we need to tackle as related to governance and policy. And as I mentioned, and as it was mentioned by Professor Arzali, the digital transformation would be key to ensure, to fix this problem of supply, to fix the problem of equity and the few doctors that are available today in countries in Africa, to treat people in remote areas, in the rural areas. It will also ensure access, I said it, equity, and quality of care. So yeah, that's
Thank you. Thank you very much.
you.